Hello everyone, this is Mo from Wound Ostomy Professional Group. What I'm going to talk about today is about the wound healing process. In wound healing process, it's important to realize what happens, what phases we have in wound healing. And if we know these phases, we can predict, and also we can predict about the how the healing is going to be, and also about the product we need to use, what management we need, what care plan we need. So what's important is like very simple. It is very simple. Like whenever you have a wound, whenever you have an injury. So when you get injury can be trauma due to car accident. It can be operation, surgical, and whatever can cause the skin breakdown. So when we get injury, the first thing we try to do, for example, if we get a cut, the first thing we try to do is we try to stop bleeding. This is exactly what we call it, the first phase of wound healing. It's called what happened in homeostasis phase. The first thing the body tried to do, exactly what we do when we got a cut, it's about put the pressure on the veins, so stop the bleeding. So what it's gonna do, it's about vasoconstriction. So we get vasoconstriction. In vasoconstriction, what the body does, it's try it like I'm trying to make it very simple. This is our regular vein, and we get a cut here, and we start the bleeding here. So what the body does, it's gonna make it make it narrow, like it's gonna make it very narrow. So like it's gonna make it like this, so we get less blood in that area, so it's gonna stop bleeding. It's gonna be like a plumber when we get a pipeline problem or pipeline breakdown. What the first thing the plumber does when he arrives, he tries to stop the water. So exactly the same thing, it happens in the body. The second thing the body will do, it's about what the body does, it's about doing platelet aggregation. So we get platelet aggregation. This one, so it's gonna make some clot in that area and prevent the bleeding. So how long is gonna take? This one takes about 10 to 15 minutes from the time of injury, and it lasts for 10 to 15 minutes. However, if we want to talk about this one, about the different phases of wound healing, I can say we always have some overlap in the phases of wound healing. Then after we stop the bleeding in our body, what we do, we try to clean it up. We try to wash it with the water, wash it with saline, clean it with the gauze and everything. So we're gonna clean the wound bed. So this is exactly the second phase of wound healing. It's called inflammatory phase. So what will happen in this inflammatory phase? We get some vasodilation. We got vasoconstriction in the first phase, that we need to stop the bleeding, but we get vasodilation in this phase to bring what the vasodilation does. We will get healing and repair cell migration to the sites. So we will get this one. What the example of wound healing and repair cell migration, I'm gonna just give you a few examples, like neutrophils. We will get some macrophages, and we will get T lymphocytes. And what they do, so what this repair and healing cell does, they remove the, what they do, they remove pathogens, damaged cells and bacteria. So the end result is gonna be a clean wound bed. And after that, when we have a clean wound bed, we move to the next phase of wound healing. What's the next phase of wound healing is? It's about to building new healthy granulation tissue. So what is called this phase of wound healing is called proliferation. So we get proliferation. This is the third phase of wound healing. What we get in this phase, we will get some wound contraction. We will get new network of blood vessels, which will help with oxygenation and also nutrients. So I'm gonna just talk about this healthy tissue and unhealthy tissue and how we differentiate them at the end of this video. But let's go back to the second phase, just give you how long it's gonna take. The second phase, inflammatory phase, it takes about 2 to 3 days. It's exactly start after the injury, and it takes about 2 to 3 days post injury. And the last phase of wound healing, it's when we get the skin integrity, when we get the skin getting its strength back. So what will happen, this is the fourth phase of wound healing. So before we go back, let's just let you know that the third phase, proliferation, it takes about 3 to 5 days after injury. It will happen. So the fourth phase, that usually starts about 21 days after injury starts, and it takes about years, 1 year, 2 year, or even more. So what will happen in this phase, and what's the phase? This phase is called maturation or remodeling. So what we get in this phase of wound healing, we will get the collagen is changed from type 3 to type 1 collagen. Let's fix it. Collagen changed from type 3 to type 1, and the wound fully closed wound, and also skin is getting stronger. So this one, it may take a year, 2 years, or even more. After 2 years, we get about 80% of the strength of the skin back. So still, we don't have a full 100% strength of the skin, just a uninjured skin part. So this is very simple way to explain what's going with the wound healing. This is the wound healing process for acute wounds. It's not about the chronic wounds. When we missed some part of those wounds, some part of those healing process, like homeostasis and inflammatory, we will get chronic wounds. So we are going to talk about the chronic wounds, what will happen, and in another video. But as I explained, we're gonna talk about healthy and unhealthy tissue to differentiate them. So it's very important to know what's healthy and what's unhealthy tissue. So healthy tissue, and unhealthy tissue. Unhealthy tissue. Healthy tissue, it's like when we talk about healthy tissue, it is a let's change the color of the pen. When we talk about this one, we will get healthy tissue. It's gonna be pink or red. It's uneven in texture. What does it mean, uneven in texture? When you look at, it's called usually texture. Usually when we talk about uneven in texture, they said berry-like tissue. Berry-like tissue is like when you look at the strawberry, how granulated it is and how uneven it is. We are looking for that kind of tissue. So that's the healthy tissue. And also healthy tissue does not bleed easily. Unhealthy tissue, on the other hand, usually is dark. That may be because it's dark, maybe because it is infection, due to infection. Maybe it's ischemia, or maybe it's poor perfusion. And if the sometimes it's pale, again poor perfusion again. And sometimes is easily bleeding, and also in this unhealthy tissue we may have other signs and symptoms like pain, like redness around the wound, and also is about heat, how hot they are comparing to other side of the body, and also we will get some different color of the tissue on the wound bed. And this is what I was talking about, and this is the end of the this video. If you have any question, please just leave me a comment. I will explain as much as I can. This one I briefly explained it. It's health tissue and healing process is very big subject in the wound care. So please ask question, and if I can, I will ask the question as soon as I can. Thank you.